Good afternoon, everybody. Thank you for joining me. Today is May 13th. Thank you for joining me for this chat. I always start off with a little humor. So this gentleman is fascinated by the internet, but his wife says, unfortunately, that's the microwave. Jen misunderstood when her dad said his phone was in airplane mode, so she threw it out the window. Whoops. Cool to know that by staying home, I'm saving lives. Yeah. Where's Waldo with social distancing edition? So he's pretty easy to find right now. I've experienced a little bit of this myself. Self-isolate, virus, red, quarantine, social media. How about doing a bit of social media distancing? Turn off the phone, turn off the device, turn off the news for a little while, and just enjoy peace and quiet. COVID-19 in Westminster, just an update. We have no active resident cases of COVID-19 at this time. All precautions and restrictions remain in place. This includes no visitors to our campus unless end of life or resident wellness. Restricting trips to essential purposes only, screening and temperature checks upon entering the campus, social distancing, hand hygiene, and mask at all times when outside of your apartment home. The healthcare center precautions. We've had 6 COVID-19 positive employees. 3 are on isolation at home still presenting with no symptoms. 3 have fully recovered or been able to come back to work. All residents and associates in healthcare center and assisted living have been tested as a precaution and are getting a second test. As a further precaution, no residents have been positive. The healthcare center is locked down and quarantined as a precaution until all test results come back. We're coordinating with the Texas Department of Health and Senior Services and the Austin Public Health Authority, and you may have seen that the governor himself issued orders for all nursing homes and assisted livings to be tested, employees and residents, and I guess again, we're ahead of the curve. We've already had that done, and those have been really good results, honestly, with no residents. That means our precautions have really paid off for us. Questions and answers. What's going on with the pool temperature? The pool heater has been replaced. We are adjusting the temperature as needed. The goal temperature is 86 degrees. That's a compromise. I understand that some people want it hotter. Some people want it colder. The United States Water Fitness Association reports that the ideal temperature for an indoor pool ranges from 84 to 86 degrees Fahrenheit. Having it hotter than 86 degrees really makes it uncomfortable for those people that are wanting to do laps and get a good workout. We don't want them to get overheated. 86 degrees is our ideal temperature. That's what we're shooting for, and we're accepting anything between 85 and 87. So 86 is the ideal temperature, even from the United States Water Fitness Association. So that's what we're going to shoot for. It gets better. It maybe takes just a couple minutes to acclimate to it, but it really shouldn't be hotter than 86 degrees. When will activities begin? The answer to that is our intent to open up limited activities as soon as we can. Bingo will likely be one of the first to be tried with social distancing and mask in place using Harrisville Hall. When we're talking about how we logistically set that up. Why can't we get a wider variety of choices with our meals? I'll tell you, we're trying to offer a good selection. We are experiencing some shortages in some products, and that has caused some limitations. If you have a specific need, though, please reach out to reception. They can put you in touch with food and beverage, and we can address the issue. We are focused on providing the best quality and variety that we can during this time. But if you have a specific need, please reach out to us and we'll try to address it. I mean, it's really an extraordinary menu. Most of the letters that I'm receiving, they've been complimentary of the menu. So we're doing our very best, but we can work with you individually if you have an unmet need. Why aren't all residents being tested for COVID-19? Who is deciding the priority for testing? And how do I get a test if I want one? We have tested all residents in healthcare and assisted living. IL will not be, independent living will not be tested unless they have symptoms or direct contact with COVID-19. We don't have enough tests. No one does. We are working with the Department of Health and Senior Services, Austin Public Health Department, and our medical director determine the priority of testing. If you want to try and go out and get your own test, I don't believe that you can. You may be able to if you have signs or symptoms, but testing is limited due to the shortage of supply, and we're doing our very best. If you haven't had contact with someone that has COVID-19 and you've been abiding by all the precautions, including social distancing, sanitizing, good hand hygiene, and wearing the mask, you should have no worry. If you have symptoms, report it to Robin Akins or the clinic, and we will get you tested. But we're not able to test everyone at this time, and we wouldn't be allowed to if we requested it. We have a limited number of tests ourselves and are only able to use them when there's actual cause for test. So I'm sorry for that. But again, if you've maintained all the restrictions and kept the precautions in place, you really have nothing to worry about. What can be done about fellow residents not complying with the directive to wear masks? It's our intent that everyone should wear a mask when outside of their apartment homes in common spaces. All residents are being redirected as needed. Please report to reception or security if this occurs. Be kind, be respectful. Sometimes, even with good intentions, we forget. I've caught myself walking out of my office door, and right when I get to the door, oh my goodness, I forgot my mask, and I put my mask on and go about my business. But I forget. Everybody forgets. For the most part, I'm seeing everybody be compliant. I have noticed very few instances where residents aren't wearing their mask. When they have forgotten, they've been redirected. When will we be able to have visitors again? That's still unknown. I don't have a good answer for you. We're currently working on a plan to reopen Westminster as well as other senior living communities. I'm working with LCS. I'm on their operations council, and I just reviewed a final draft. We're finalizing, I should say, it's probably the third draft. We're finalizing the draft and preparing for a phased approach to reopening the entire community. But it's going to take, we were the first to close and we'll be the last to open because most of you are considered vulnerable population. I appreciate your continued patience, and we'll work on a solution soon to get those visitors in. But it'll be social distance, masks in place, and it'll be in a safe environment. We'll do a few visits at a time. Our new residents moving into Westminster, I had this last week. Yes, that is happening. A few residents have been moving in, all of which have been on our waiting list for years and have been in process of moving in for several months. We're not stopping them. We are restricting their movements around the campus, using isolation and screening procedures, and restricting who can help with the move-in. And they are being told that they can only go to their apartments and out, and that's it. They cannot go into the common spaces. They're restricted to movement in those apartments and to those apartments. When will independent living residents be able to visit those in skilled nursing and assisted living? Their restrictions to necessary visitation should be lifted by the end of this week or early next week. Healthcare will reach out individually to those that are allowed. So, they've been under quarantine for this time while we await the test results. And then hopefully late this week, possibly Friday, early next week, we'll have all the test results back. And then we will open up to necessary visitation. That means resident wellness visits or end of life. And we have to restrict that still today because they're even more vulnerable population than independent living. Is it possible to provide some clarity for emergency announcements after a fire alarm? Yes. When the fire alarm sounds throughout the Preston or Windsor or both, an all clear is to be announced after it's been resolved. That typically involves the building designation in which the alarm originated. So if apartment 220 had a fire, had burnt some oatmeal, typically we can limit it to just alarming in that apartment. But occasionally, it gets outside of that apartment. And if that happens, then the entire building alarms. And typically it's restricted to just that building. So we put out the fire for the oatmeal and we resolve the issue. Then we silence the alarm. We reset the alarm once the smoke has cleared and everything's okay. Then we're able to reset the alarm. At that point, when it's resolved, an all clear for the Preston will be announced. That means that the alarm situation has been resolved and it's all clear. We say all clear for the Preston because that is the building that it originated in. If it's an all clear for the Windsor, then they will say all clear for Windsor because that's the alarm origination point. But it doesn't mean that one building is still an alarm. Once the alarm has silenced and the all clear has been announced, whether it's Windsor or Preston building, that means that the situation has been resolved. The alarm is no longer needed and the situation's resolved. So if one building is not mentioned, that should not be a concern. The concern should only be when the alarm continues to sound and you're told to evacuate by us or the fire department. Remember, you're supposed to shelter in place if the fire alarm sounds. The all clear means the situation was resolved regardless of which building is announced for the all clear. What should residents do during these COVID-19 restrictions during when a tornado warning has been issued for our location? That wasn't a very well worded question, but basically they're asking what to do with a tornado warning in the area during these COVID-19 restrictions, the social distancing. You should apply your mask and move out of your apartment to an internal location away from doors and windows. So ideally you would move to a center hall or an elevator vestibule away from doors and windows. You should also shut your door to your apartment behind you. Shelter in that location while maintaining social distance, so at least 6 feet apart and having your mask on as much as possible 6 feet apart until the warning is over. An announcement will occur when the warning is canceled over the emergency call system and the business telephone system, which is located in the halls. And this is really important right now because May is a really active month for us when it comes to thunderstorms. So again, social distance with your mask on in an internal hall away from windows and doors. Could we please stop referring to the pending bistro remodel as the Healthy Options Cafe? Maybe we can just call it the bistro. Yes, we are working on a name for that right now. I know that it's it's been a turnoff to some people to call it the Healthy Options Cafe. Just because we're saying it's healthy options doesn't mean we're going to get rid of cheeseburgers and fries and onion rings and things like that. So we're working on a name for it right now. We're honestly thinking about the Windsor Cafe. If you have any suggestions, please submit them to me via email or drop a note to reception person addressed to me, and they'll be sure to pass it on and we'll consider your name as well. Question, if your car battery has died, will plant operations maintenance personnel provide a jump start, or do you have to call a service station or AAA? Again, I've addressed this before. We will do our best to help you in any way we can. We do have the ability to jump start a vehicle if needed. We have a jump start kit. Our staff has many responsibilities and may not be available to handle the request timely because it conflicts with other priorities that they have. That being said, we'll do our best to help, and yes, we can do that. But remember, plant operations is only here typically normal business hours, after hours that would be security or concierge, and they have many, many responsibilities. So if you're understanding and willing to wait, absolutely we'll do our best. I would personally come out and jumpstart your car if you needed me to, and we'll do our best to help out there. Why weren't the signs in the elevators updated when Chuck, me, and the Austin Public Health Department issued new guidance? They should have been. The signs should have been updated. This was an oversight and has been corrected. The screening protocols for the community, they were changed timely. So they implemented on the AccuShield stations timely and did what they were supposed to. I apologize for any inconvenience, any inconvenience or confusion that might have caused. It was just an oversight. It was missed. Reminders from the residents. This was asked during the building and grounds meeting that we could pass these on. Please wear your name badges. If especially residents, new residents, I'd love everybody to wear their name badges, and a lot of residents really like that. It's difficult to see who you are now through those masks. So if you're able to, if you have a name badge, please wear it. If you need a name badge, just reach out to reception and we'll print one for you. And I appreciate that. And I think the residents that live here may really appreciate that as well. Please stop feeding the birds, especially at the elevator and in the visitor parking garage. It's really making a mess. So we would ask that you stop doing that. If you want to feed the birds, feed them in the grass, but not in the elevator vestibule by the Harrisville Hall elevator or in the parking garage. It's really making a mess for our housekeeping department. Stay strong. Thank you for all your cooperation. Hope you all are staying well. Appreciate your time today. And I hope everybody gets to enjoy the flyover today at 3:40. Thank you.